Hey, GLP1 Plus Sides community. Before we jump into the podcast, please take the time to leave us a 5-star review on whatever audio platform you're listening to the podcast on. Share your story and how the podcast has helped you. This will help us get referred up in the audio platform so that we can reach more people that need our help, our support, and guidance from our doctors. Help us get loud and change things. Are you interested in understanding GLP-1 medications like Ozempic, wegovy, or Mounjaro? Then join us on the Plus Sidez, Cracking the Obesity Code, the groundbreaking podcast helping people change their lives one episode at a time. The Plus Sidez podcast is a disruptor. We're breaking down barriers, smashing stereotypes, and sharing inspiring stories that'll leave you feeling informed and empowered. Join us every week to learn from doctors who are specialists around GLP-1 medications like Ozempic, wegovy, and Mounjaro. They'll provide you with science and facts to validate these incredible stories. But that's not all. We'll also bring you the voices of the GLP-1 Mounjaro TikTok community, real people who face the challenges of obesity-related diseases and disorders and discovered the incredible plus sides of GLP-1 medications. Our episodes are filled with heartwarming stories, laughter, and moments of triumph. You'll connect with our amazing community members who are reclaiming their health and experiencing their fullest lives. Are you ready to embark on a journey of discovery and empowerment? Tune in to the Plus Sidez, Cracking the Obesity Code, and together we'll change the narrative around obesity and end the stigma. Subscribe now on YouTube or your favorite podcast platform and join our incredible community. Let's celebrate the plus sides of life together because every story deserves to be heard. Every life deserves to shine, and everyone deserves access to expert knowledge and medication. The Plus Sidez podcast. You're not alone. It's not your fault.
"20 seconds a week to lose 20% of your weight in a year with diet and exercise. That's the power of GLP-1s through Ro. Ro helps find the medication that's right for you, based on cost, availability, and your weight loss goals. Losing weight with GLP-1s is possible through Ro.
I'm Dr. Alexandra Sowa. My handle on TikTok and Instagram is at Alexandra Sowa MD. I am an obesity medicine doctor. My primary training is in internal medicine. I'm a mom of 3 boys and happily married, and I love this field. And it brings me so much joy to hear people talking about weight loss medications openly. I mean, really, it's like the thing that fills me up. You're talking about joy and messages and the divine. You know, for 10 years, I was practicing in this field, and I had to be very quiet about what I was doing. I tried to be vocal, but there was such an influx of lifestyle. I won't even call it medicine because I believe in lifestyle medicine, but just like lifestyle on Instagram, like do this shake, lift weights, it'll solve it for everyone. And I'm saying, no, right. Obesity is a disease. We've known this for a very long time. Obesity is a disease and it causes diseases. Why are we trying to fill this up with fluff? And so now to have people so willing to talk, and yes, we're frustrated, but just that people even know that there are resources here. My little field is still incredibly tiny. We only have about 7,000 doctors out of 1 million in the United States who are board certified in the field of obesity medicine. When I trained not that long ago, 15 years ago, we didn't get a single lecture on what to do about weight. And that's actually how I came to this field, because I would be in my internal medicine clinics treating end-stage type 2 diabetes, heart disease, have people maxed out on high blood pressure meds. And they would say, well, counsel them on weight loss. And you'd be like, well, how? Right. I come from a family who all of the women struggled with weight. And so we talked about weight loss nonstop. I luckily grew up with a healthy relationship with food, but it was like, what's the newest Weight Watcher point technique? Like that, This is literally what we did every weekend. And I knew that like these traditional tools weren't working for my family who was doing everything they could possibly do. So what else was there? And so when I found this field of obesity medicine, metabolic health medicine, there was no going back for me, but it's taken a few years for people to catch up. And it's so amazing to now have people willing to talk about their journey.
Yeah.
When I first started, patients wouldn't even tell anybody. And it's their right to not tell anybody. But now people are like, look what I've been on. It's a celebration.
Yeah, it's true.
Yeah.
I was shy about it at first too. Kim, which way are you looking at it right now? Depending on Zoom or whatever. Anyway, right? But Kim took me out of my shell on that. I was afraid to tell anybody what I was doing. Oh, I'm just, no, it's so true. It's so true.
Yeah.
You're coming out of the dark.
It's amazing to share the journey. So I'm so happy to be here, and I'd love to share my experience and tell you a little bit about the tools that I've been creating to help people out there.
I would love for you to describe what it means in terms of metabolic disorder or metabolic science. Can you explain a little bit about what that entails, and what that, not just like how to treat it, right? Which we know there are nice treatments for it, but like, what is it and why do these treatments work? How do they work?
Janine, you were saying this at the beginning, that it's not just type 2 diabetes. There's like a root to insulin resistance and metabolic syndrome that predates it. And I don't think that most people know that. So people think that fat is the main thing that we're treating. And actually, it is so much bigger than that. Fat is an annoyance, but it's both the secondary endpoint to metabolic dysfunction, and then it creates more about metabolic dysfunction. So in treating it, Lisa was talking about how her adhesions were decreased, how some of her emotional trauma from childhood was decreased. There's a reason for that, and there is science there, right? We know that people who carry excess weight have increased rates of abdominal adhesions significantly. We know that, unfortunately, children that carry childhood trauma have about 50% increased rate of obesity down the road. And then that leads to depression and anxiety and inability to heal. So the fat itself has a lot, it's really active, is how I like to describe it. It's really the most powerful organ, in my opinion. And metabolic syndrome, or metabolic dysfunction, as I call it more globally, is really what happens to lead to the fat. And whether that is binge eating disorder, where we have decreased leptin, which is a satiety hormone, and like a lack of reserve in the brain and stomach for stopping, whether we see that, or we have insulin resistance, which is like, insulin is my jam. It's my favorite hormone to talk about. We have all sorts of imbalances that will then lead to weight. And then when you put on the weight, we have negative feedback signals, and that further dysregulate what's going on. So a lot of times people will come to me and say, I am trying so hard and the weight won't stop coming on. And I know you won't believe me, they'll say. And I'm like, of course I believe you. This is all I do. Of course. Like, you don't need to preface that. But what happens is that as insulin resistance grows, as metabolic syndrome dysfunction grows, it's really impossible for the body to become efficient at burning whatever you're bringing in. And it just goes into a fat storage mode. So metabolic dysfunction globally, I include as insulin resistance, even early insulin resistance. And then the true definition of metabolic syndrome has to do with elevated blood sugar, low HDL, which is the good cholesterol, high triglycerides, which traditional doctors are looking at, and I'm not sure why, because high triglycerides are a sign of your body just not understanding how to take in carbohydrates. Truly, they just don't know what to do with it at all. And if you see that, it's a roadmap to tell you what to do next. And then we also see increased abdominal circumference, which weight, right? It's a more scientific marker actually than weight, because weight is not always the biggest indicator. I long recognized that there was a problem, that people would come to me and say, I ran all the labs and everything looks fine. And then I'd look at the same set of labs and I would be like, but no, you have early insulin resistance, you have metabolic syndrome. And to somebody's point, I don't know who said it at the beginning, but like, we are a system that only looks for the disease state. So it's ridiculous for a patient to come in with a hemoglobin A1C of 5.6, which is how I trained. And they're like, maybe eat a little better, but we weren't even using the words pre-diabetes. And at that stage, it's just a runaway train. Like, for most people, it will progress to type 2 diabetes. So we want to catch, and insulin and then I'll stop talking. I know I could just go on and on about this today, but
Oh, please.
No,
This is
please.
an education place.
Don't stop
This
talking. You're good.
is the place where we want you to talk. Yes.
But insulin, and we use the term insulin resistance, but what is that? It means that the body is producing insulin. Your body, your pancreas is producing insulin, but your body's not receiving it, and it's giving a signal to go back and make more insulin. And insulin is a hunger and a fat storage hormone. And so it's actually a very useful, scientifically validated tool that's not used in clinical medicine, where we can test your fasting insulin. And if your fasting insulin is high, and even if your hemoglobin A1C hasn't caught up yet, we can predict pre-diabetes or insulin resistance 15 years before we start seeing an increase in the average blood sugar marker.
Oh my goodness.
And you guys were talking about PCOS, and this is what we see in PCOS. I love PCOS patients because for me, they're actually very simple to manage, which is so sad because they feel like they're the most complicated patients.
Yes.
Yeah.
Right?
That was like simple. Wow.
I know. And that's not to minimize what anyone has gone through, but it's pretty straightforward. And I think it's very sad that we don't have more tools in traditional medicine. Now, all my doctor comrades are doing like the best they can. They get 15 minutes. Their boss tells them that's all they get. And we didn't necessarily learn about these things. But, PCOS is a disease primarily of just insulin resistance. And that insulin resistance gets worse. And then the disease of PCOS gets worse. And fat comes on, and fat makes PCOS worse. And it's just horrible. You said chicken and egg. It's like it's a little bit of both, but they're very interrelated. And if you can target the insulin resistance through diet, lifestyle, knowing what to do without killing yourself on the treadmill or eating like rabbits, like knowing how to eat, and then using the right medication, we can really get to the root of it and then change the trajectory of all the other things that come along with it. So
food has definitely been a very dominant voice in my head. That's not the main focus anymore. Dieting, exercising, and adding GLP-1s through Ro is a game changer. I have such a sense of mental freedom since I started with Ro. Food no longer controls my thoughts. Family time used to revolve around food, and now it revolves around what we're gonna go do together.
There's something that we've kind of experienced, and Lisa talks about it too, in her story and on her TikToks, around this sort of like, I would say sort of like anomaly, if you will, of what we call food noise. And a lot of us have experienced what it was like to have it and then what it was like to not have it. And so like for me, for example, it's kind of different for everybody, but it's not just for me, it wasn't just the thought of constantly feeling like I needed to eat. It was almost like if I was a car and all I had was just drive, just eat, consume. And then when I got to a certain level of this medication, I was able to gear shift in my mind, like, do I want to eat that? No, I really don't. Or do I really want that? No, I'm just thinking about the memory of that and the dopamine hit of that and not actually what I want. And then my palate changed and all these different things started to change and open up. And so it's very like amazing to realize what you can do when it's not so noisy in there,
Right.
But what is that? Like what we feel this and we all know it's true, right? But what is the like clinical behind that? What's causing that?
So these medications, whether we're on Wegovy or Mounjaro, have GLP-1 in them, and Mounjaro has two hormones, GIP, and we have these receptors all over our body. They're everywhere from our gut to our pancreas to our heart to our brain, and they have just proven to be very effective at down-regulating the up-regulating nature of addictive behaviors. So we've seen this not only with food, but also alcohol. This has been, I have patients who are in recovery who this has been such a helpful medication for them. We're treating them primarily for excess weight, but it's like the best gift to them that they have this, bonus, that they don't want alcohol either. And really, that's what it is. It's a chemical process in the brain. And like you said, so much of food is a dopamine hit. And we have other tools. And one of the things I want to say is, and I know you guys primarily talk about the amazingness of these new wave of medications. And it's true. They're pretty amazing. But not everybody needs these meds. And I think that is a misconception now.
I think that's perfect. Let's please talk about that.
It's just, we don't all need to start here, really. And
Yeah.
there are a lot of people who will respond to other medications that do work on parts of the brain that decrease reward reception. So Contrave is a medication that is made generic and is very, very affordable. And for many people, it can be a super useful tool, especially for maintenance. It is not as dramatic because we don't experience the stomach emptying, but it gives that pause. Like that exactly.
Pause.
Like you can pause and think. And you've learned tools, hopefully along the way with GLP-1s, where you can like, okay, this is my framework. This is how I plan. I'm very big on lifestyle and behavior change in my practice when anyone goes on medication, because a medication can take you super far, but it can only take you so far. And you do have to learn how to, your brain is like the biggest, I have a 10-week course, and the second half is all on how you manage your brain.
Yeah, that's cool.
And food. But really it's your brain, because that's the biggest thing that starts to work against you. And I know there's a lot of panic right now among people where the coupons run out, and it's like the brain spirals first. And it doesn't even allow us to see some other options. And so in working with an obesity med doc, there are lots of other tools. I was in practice for almost 10 years before we had a weekly injectable, before we had wegovy, before we had Mounjaro. And now there's going to be a role of a lot of new meds that are even more effective than what we have out on the market, hopefully. But there are other tools. And sometimes, like, I had a woman just recently who, she's 50, and her doctor was like, well, you're just soft now. Like, I think that's what the words she actually used. And, you're not carrying too much weight. And she's like, but I put like 30 pounds on. Like, this isn't like, I was very thin before, but that was how it was my whole life until like 46. And we helped her with diet, but also we used this Contrave medication, and it just gave her power back in her brain. And she didn't even know, and she didn't need the full kit and caboodle. And if you need the full kit and caboodle, that does not mean that it doesn't mean anything. It just means that you do. But there are other super useful tools out there that are a lot more affordable. And we should preach that too, because it's not like an all or nothing game. And Lisa had said that she was working with, and I think she had an appointment upcoming with an obesity medicine doctor.
Yes.
I think that's really important, because I think a lot of doctors are outside of their comfort zone writing these meds, and they have no idea. They're like, okay, I'll write them for you. You're bringing me the information. I'm learning about it just like you're learning about it. And that's okay, because doctors can't know everything under the sun.
No.
But finding a specialist can help in this transition process too, and help you potentially troubleshoot other meds that will help with maintenance until we get tirzepatide approved for weight loss, and before we have some other meds, and just finding what the right fit is for you.
I want to know, in terms of like that constant needing to eat, like eating disorder that comes around with obesity, with insulin resistance, with metabolic issues, where's that coming from? I mean, is it sort of the same? Like, what is it that's affecting the brain to where it feels like it needs to constantly be ingesting food,
I think it's multi-dimensional. I think there's definitely an emotional component of feeling something when you eat, right? And so tapping into how you feel when you eat, I think, is really important, and is like something I try to give to my children. Like, why are you eating? Are you hungry? Do you feel it in your stomach? And we really try not to reward or punish through food in my house too. Just to it's like very healthy from a young age relationship, but not everyone can have that. And we can develop an addiction to food as we age, just like an addiction to alcohol or drugs, and our brain. And I think what happens, though, specifically in binge eating disorder, and we see this on the flip with anorexia too, we start to change our hormones to support this new state. And we see a huge rise in insulin after an episode of binge eating disorder. We see a decreased rate of leptin release after a binge eating episode. So that hormone I was talking about, where you are supposed to be satiated, it like doesn't come.
Right.
So the mechanism becomes broken, and it comes like 2 hours after the fact. But at that point, you're so unwell that you've rolled yourself to bed and are in pain, right?
Yes.
Right.
And so it's both emotional, but then it becomes very hormonal. And insulin, as I was mentioning before, I think is really important to kind of keep tabs on, because if you have an episode where you overeat, and you do it repeatedly, your insulin level will constantly be in a state of high. And a high insulin level signals for your brain to store fat and to eat more. So then it does become just a cycle that you cannot break.